Hi, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss step therapy for medications. Is it an ethical practice or a bureaucratic mess? Blue Cross Blue Shield, probably the most common insurance that most of us with fibro have besides Medicaid, they define step therapy as a program to ensure that members receive the most appropriate and cost-effective drug therapy, where some plans require that additional steps be taken before certain drugs are covered. In a prior authorization, certain clinical criteria must be met for some drugs to be covered. So this requires that your doctor call the pharmacy to request a prior authorization for these drugs. Step therapy requires that you've tried an alternative therapy first, or that your doctor has clinically documented why you cannot take that alternative, less expensive therapy. Some feel as though this process gets in the way of effective or immediate treatment when it's really most needed. When you suffer from chronic illness, like fibro, likely you're working closely with a specialist who's inherently knowledgeable about your condition and who knows what you need for treatment. When your physician prescribes a medication for you, for example like Savella, that needs a prior authorization, you should expect that you can run over to your pharmacy and simply get it. This just isn't the case for so many expensive or new medications today like Savella. And it's not just because it's too expensive, or is it? All insurance companies practice step therapy and prior authorizations, even Medicare. This is to save them money, not you, and most often creates a headache for you, and you spend several days or longer maybe making phone calls or trying to get the medication you need while you suffer in pain. So when you have to meet the criteria for a step therapy program for a medication, first your script must be filled by a cheaper medication. Next, if after that first medication is ineffective for your condition, you advance to the second step of being allowed to get a more expensive medication, but maybe still not the one you actually need or the one you were prescribed. After you've exhausted a trial of all the pre-drugs, you may be allowed to get the medication you initially needed and were originally prescribed by your physician, who knew that you would not respond to all these other medications in the first place. So the scripts get rejected back to the doctor's office with a form from the insurance provider that must be filled out describing your medication needs, and then the insurance provider determines the step that they'll take with you, which will be to make you follow protocol and start from the cheapest and the least likely drugs to be effective. That process just took 2 weeks minimum, and the patient suffered through it to satisfy the insurance company. The insurance providers want you to believe they use physicians, pharmacists, and medical experts to determine what medications are safest to use and most effective. Then the insurance provider approves what drugs will be stepped and how they fit into your drug level. Make no mistake, the insurance providers do this all in-house and are completely responsible for the selections and levels of medications, because in the end it saves them money. Oh, and it saves you money too, right? The $10 or $20 it saves you on a copay. But what you really want and really need is the right medication at the right time, not to save $10 or $20. Step therapy programs are purposely activating the law of unintended consequences by trying to regulate a complex process which promotes a slippery slope of unfavorable results and exacerbates both overall and well-being and cost consequences. This throws risk back onto the physician. The physician feels as though they have to jump through these hoops to accommodate the insurance providers, who subsequently is not even in the health equation in question. And the only way to conform effectively and safely is for the physician to modify the form to suggest that the patient has already tried the other drugs unsuccessfully, or that they're not going to respond to other treatments. This is part of the reasons physicians don't like working with fibro patients. It's the BS and the bureaucracy. Most of the time this won't work either, since all the insurance provider has to do is check if the criteria was met by looking at your records or notify the Medical Information Bureau, who document everything in the person's health history. Additionally, adhering to step therapy protocols has a direct impact on driving up ER and inpatient costs, since patients are not being effectively treated when they need to be. Often they're spending more time in medical care searching for help, especially the ERs and urgent care facilities. Plus there'll be longer stays in intensive care, longer rehab stays, and more missed time from work. This does not always simply mean that the patient who is being dragged through the step therapy process merely has to wait a week and get the drug they need, and thus suffers a little extra chronic pain that week. You have to consider the thousands of instances where patients who may be suicidal or are waiting for the correct antidepressant drug to kick in, and it doesn't get there in time. What's the cost savings in that instance? And there's another 1,000 examples, just like this one, that clearly state the need to eliminate step therapy insurance programs. People want to save money where possible and will gladly accept a generic medication most of the time. But when there's extenuating circumstances, the physician may reach for the restricted drug first. A good example of this is I had major reconstructive foot surgery last year, and afterwards I was given a mild narcotic every 8 hours. This was totally ineffective for controlling my pain, and I asked for something else, something stronger, and I was told that my insurance requires step therapy after surgery. The step therapy started with a low dose of Dilaudid, which has a really short half-life and provides about 20 minutes of pain relief each time I get an injection. And that's every 8 hours. I was going crazy, but there was nothing I could really do. Needless to say, I spent the next 3 days in agony waiting for my insurance criteria to be met so that I could get something stronger. After 3 days of satisfying the first step of criteria, I was moved on to the next step of therapy, which was a low dose of Percocet every 6 hours. And this was almost as bad as the Dilaudid. I had to take this medication for 7 days before step 3 would kick in and I could finally get OxyContin, which, by the way, was what my doctor prescribed in the first place, and which provided sufficient pain relief. So I'm not sure I could go through another 10 days of that kind of pain again. You can write to your state legislator about these programs and voice your opinion if you wish. It may help the overall cause. Thank you.